skyrocketing costs of the EpiPen are causing people to look north for a solution. Families are resorting to buying the life-saving EpiPens in Canada, where the cost of the drug is around $200 compared to more than $600 for a pair in the U.S. This as Mylan caved into pressure from consumers and lawmakers this week, announcing that it would be making a generic version which would cost about $300 for a pair. Here to weigh in is surgeon and physician Dr. Kelly Powers. Doctor, good of you to join us this morning. All right, so, I mean, that's the situation that this country is in, where if you need one of these and can't afford it, you're getting in the car and driving north of the border to buy an EpiPen?
That's right. Well, nice to see you guys. Great for having me. So the sticker shock of the EpiPen has sent people looking for parents looking for alternative means. And in particular, not just driving over the border, but there's online pharmacies that are based in Canada that if you have a U.S. prescription for EpiPen, you can actually get it online and they'll send it to your house. And a lot of the critics or the parents or the allergy advocates are saying, hey, you know what, this might actually be easier.
All right, well, that may be a reality for somebody who lives close to the border, but if you're in one of the central United States and you're saying to yourself, I can't afford to buy this, but my kid needs it.
Correct.
When you go to the doctor and you're a parent and you say, well, I'm just not going to be able to afford it this month, or I'm not going to be able to afford a new one, and our old one expired. What is the doctor telling those patients right now?
Yeah, I know. It's pretty sad. About 15 million people in America have a food allergy, and about 20% of people have drug allergies. So this is a really serious thing. And they say, I was reading a stat last night, about 1 in 13 children, so that's every 2 children per classroom, has a drug allergy. So this is a serious concern. You know, it becomes more of an ethics issue.
Well, but that's why Mylan stepped up and said we're going to increase the reimbursement for people who need help.
But most parents say that that's not making a difference.
It's $300, and then the amount that I think that the income level that they cover in terms of like for the low income family reimbursement, it runs like a family of 4, like $90-some thousand in annual income. That if not for nothing, if you're making $90-some thousand a year in annual income, you can cough up a few $100s for a 2-pack EpiPen for a year.
But not everyone can. It's a life or death
crass
situation.
And it's more than
like
just
these are not people who are making $10,000 a year.
But so it's more than just cost. So actually there's another factor is expiration date. So these EpiPens have a shelf life of just 1 year. Then also factoring in, you've got multiples. So say your child has an allergy. You have to have one in the house. You should have one at school, at daycare, maybe in the car, in mom's purse. These are all factors because you don't know where this allergy is going to occur, what's going to be the trigger. And then if you have multiple children with multiple allergies, then the price starts to go up.
There is a competitor. It's just not the actual pen.
Right.
The pen is different. So learn how to use it. Go to your doctor and say, I'm not paying for the EpiPen. Teach me how to use it. I know it's harder. It's the issue is the medical device.
That's right. It's the auto-injector.
And Dr. Powers, we also want to get your take on this. The FDA is heightening its warnings about the dangers of taking painkillers in conjunction with sedatives and anti-anxiety medications. Should people be vigilant about the combinations of drugs that they're using, even if those drugs were prescribed by their doctor?
Yeah, well, absolutely. I think this has been around for a long time. And, you know, I mean, maybe I'm naive in thinking that it has been common knowledge, but you don't want to combine certain medications for many reasons. One, you know, overdosing. Others, liver toxicity. You know, it seems to be common knowledge. You know, drinking alcohol with opioids is not a good idea.
I think so, too. I think people who do that are not doing it because they don't know. They're doing it because they do know and want to get high. That's kind of what I think.
Wow.
Yeah, everyone knows that. Everyone knows don't mix anti-anxiety medication and Vicodin or
If you have a
painkillers.
legitimate doctor, that's the first thing that they tell you.
Yeah,
if you're taking this, do not drink alcohol.
Context clues. Context clues.
But I guess though, in the back of your mind, somebody might always think, all right, it's a Tylenol. You know, I'm going to be fine. Like if I mix this with something, or I mean, people, you're really not supposed to do that with alcohol even.
Right.
But people kind of throw that to the wind and do it anyway.
You know, Percocet is actually often liver toxicity happens because people don't understand that it's actually with acetaminophen. So you've got this opioid with acetaminophen, which is Tylenol, and then people are like, oh, I'll just take a Tylenol on top of this, and all of a sudden they're taking this overabundance of Tylenol, and they can end up with liver toxicity.
All right, and Dr. Powers, we want to ask you about this as well. A new poll released by the Kaiser Family Foundation finds that nearly half of Americans are wary of traveling to places where people have been infected with Zika. Are we overdoing it with these Zika fears right now?
Zika, the endless battle, right? Well, obviously paramount are pregnant women or women that are trying to get pregnant, and we know this. The biggest issue is that there is kind of this unknown or this debate in the scientific community of how long it lasts in the system. Is it for the extent of the symptoms? Does it stay? I was reading a study that said it stayed in the sperm for 6 months, so it could become an STD. Does it stay in the body for 2 to 3 years? Say, we decide to go on a vacation to Cancun and we get Zika, and then we want to get married and have kids in 3 years. Is it going to be in the system? And the studies are kind of pointing to no, that it is eradicated after symptoms, but there's a chance that it can still be in the system, and I think the unknown is what's scary.
I mean, I was in our pediatric office the other day, and I mean, like, doctors have posters up on their walls trying to answer questions because I'm sure they're getting bombarded with questions that they quite frankly don't have the answers to.
Yeah.
And it was kind of like, here's what we know, here's what we don't know about Zika, because
probably a longer list than the don't know.
It boils down to don't travel to Florida if either you or your spouse want to have kids, period.
But it's a worldwide...
Don't go somewhere.
It's a worldwide situation, though, too, because actually Singapore just got their first case right now with a pregnant woman with Zika. So it's global.
Yeah,
and it
Puerto
Rico is a
contained
horrible problem
to tropics and subtropics, and it seems to be kind of creeping forward now that the Florida cases are apparent.
Very good. All right, Dr. Kelly Powers, thank you.
Thanks so much, guys.
All right.